Greetings, everyone. We would like to welcome you to our live webinar presentation, No Surprise, Provider Data Accuracy Mandated. Today's webinar is co-sponsored by LexisNexis Risk Solutions. If you are on an airplane right now, you'd need to listen to some safety instructions before the plane takes off. So buckle up and please pay attention to these brief items of note before our webinar takes off today. All attendee lines will be muted for the duration of the webinar. If you are having trouble with audio, click on the upward arrow next to Audio Settings on the bottom left of your toolbar to adjust your settings. If you continue experiencing audio issues, please refer to your webinar invitation to join with your phone. To ask speakers a question, click on the Q&A icon in the toolbar at the bottom of your screen. Simply type in your question and press send. If you need any assistance during the webinar, please contact the Health Web Summit office at 209-577-4888. As payers are grappling with payments and billing process changes, they might be missing the new rules about provider data accuracy that go into effect in January 2022. This webinar will discuss the new directory accuracy requirements, highlight what we might expect after January 1, 2022, and provide insights on how this bill creates risk for payers and the best strategy to mitigate it. We're pleased to welcome our speakers from LexisNexis Risk Solutions. John Markloff is a Senior Director, Provider Data Strategy. John brings over 15 years of provider data experience across multiple areas of healthcare. Laura Long is a Vertical Solutions Consultant, Provider Data, and is responsible for architecting provider data solutions for LexisNexis Risk Solutions across all segments within healthcare. We're now ready for our speakers to begin.
All right. Good afternoon, everybody, and thank you all very much for joining our webinar. We'll be kicking off in a moment here, and we'll get started. As the intro said, please feel free to type any questions into the question box, and we will answer them as best we can as we move forward throughout the webinar today. Laura, if you could please go to the next slide. As the opening indicated, we'll discuss a couple of different topics today. We'll get into some details about what the No Surprises Act actually is, what's still to be determined, and what is required of payers. And then we'll discuss some of the risk that payers may see as a result of this risk and as a result of this new legislation, and some of the strategies to help mitigate that risk along the way. So we're very excited about this content this afternoon. So I'm going to turn it over to Laura to get us kicked off.
Good afternoon, everyone. We're going to start this session off with a little poll question around preparedness or readiness. So I'd like you to take a look at your screen. We want to know and get a feel from the audience, are you prepared for the No Surprises requirements for directory accuracy? You can answer yes, no, or maybe, but I'm not familiar enough with the act to say. We'll give everyone a minute here to respond, and we appreciate the participation. Okay.
All right, looks like we have a good number. Thank you for all of those that participated.
Oh, 1 second. There we go. So we want to start off by introducing the legislation and what exactly the No Surprises Act entails. So the No Surprises Act is part of the larger, broader healthcare transparency initiative that's happening within the United States right now. So the hospital pricing transparency timeline that you see on your screen isn't just related to directory accuracy. It was intended to create a platform for patients like you and myself to really understand the cost of a specific healthcare event, so we can shop and understand really what a procedure or a specific treatment plan would cost us. And really that's at the hospital level. So you're able to see, what something would cost across different health systems. The No Surprises Act specifically, it mainly addresses any discrepancies between costs and pricing and payments between the payer and the provider. There's a lot of legislation, over 300 pages of legislation, and within that, there's about 10 pages that reference directory accuracy for members. And why that's important is because you and I, as members of a health plan, we want to make sure that we have access to accurate data. We want to make sure that when we go to see a provider and the directory says that it's in network, that they're actually in network. So the No Surprises Act for directory accuracy is aimed at creating quality data in a directory for members. As you can see here on the star, this is where we're at today. Technically, according to this timeline, late spring, which I would say we're in late spring, the federal agencies are due to release the proposed rules, which means we're kind of waiting for legislation or the regulations at this point. We have the contents of the bill, and that's what we're going to be talking about today. All of this goes into effect January 1st, 2022. So the No Surprises Act, specifically around directory and member-facing directory requirements, it's really, the Act itself covers surprise medical billing. But it does also reference that all group or individual health plans must expose a verification process for providers. The goal in that is, again, making sure that the providers verify their own information is accurate and true. That goes for their location, specialty, and a couple other attributes that are part of the legislation. What happens or the result of that, if anything is incorrect, the current bill states that if a health plan notates a provider as in network and they are not, or they are out of network, there will be refunds due to members, plus interest that would be paid for by the payer. So basically, at the end of the day, the member is only responsible for an in-network fee, even if that provider was in fact out of network. Some of you may be curious how this applies to current regulations around directory accuracy. As of right now, we are currently under the understanding that these regulations are in addition to CMS regulations, that any existing member-facing directory regulations exist and are separate from this. We are awaiting additional detail. Again, we don't have the detail of the regulations. We just do have the information as described in the bill. And we're going to go through common concerns and unknowns. So the Act as stated today, or the bill as stated today, basically says that every 90 days, a provider will need to verify their information. Now what happens if that doesn't happen? We're not sure yet. So we're waiting on the regulations to tell us, penalties, enforcement, who's going to enforce these policies, and what are the penalties for noncompliance. We do know that historically, relating to member-facing directories, there have been audits by CMS, the regulators of the existing legislation. Those audits have resulted in threats of fines, as well as action plans, business plans to remedy the problem. So that's historically what has happened. Again, we are waiting to hear and waiting to understand what will happen relating specifically to the No Surprises Act. The third point on here, there's an item in the bill as written that says there is a 2-day turnaround for updates. And we wanted to highlight that here because 2 days is not a lot of time to turn around an update for a provider and get it exposed to your members. So we're really watching how the legislation and the regulation is written for this 2-day turnaround time specifically, because it doesn't state exactly in the bill today how that 2 days, what's the start time of that 2 days? When does the clock start? It doesn't state what does that mean for the update. Does it have to be in internal databases? Does it have to actually be 2 days exposed to the member that something has changed? Is it, for example, can a payer put in that directory that an update is pending? So we're really waiting to hear really how that information is going to be enforced. Another common concern we're hearing are around downstream systems and data governance. So the idea here is that if a practitioner or a provider does not verify their information within every 90 days, the legislation states it would be removed from the directory. So we're hearing concern, and again, the regulations forthcoming will hopefully help clarify some of this, but we're hearing concerns around removing providers from a network and what that really means, right? So downstream systems, meaning how does that affect your network adequacy? How does that affect claims payment? We're hyper-focused on that because we want to make sure not only do we understand how this affects the directory itself, but how this will affect payers' downstream systems. The last one being data governance, right? So you want to make sure that you have the same information for a provider across your enterprise. So that's another thing that we're focused on is how do we make sure that data that needs to be updated is being applied appropriately across an enterprise-wide data system. We're going to talk now, I'm going to pass it over to John. We're going to talk about the industry challenges, historical industry challenges for directory accuracy for payers.
Thank you, Laura. And data governance is an appropriate spot to end on some of the common concerns and unknowns. I think a lot of us on this webinar today understand some of the provider data challenges as they relate to the inbound sources that we all must acquire and interact with on a regular basis in order to stay compliant with existing legislations and those that are forthcoming. Inaccurate data is pervasive in the industry standard sources such as state license, MPI, so on and so forth, that we are all required to acquire and report upon. They're also incomplete. A lot of the data sources that we acquire, or that are acquired and have to be reviewed, are good for a specific piece of information. I'll pick on the MPI because it is good for the MPI, and that's about really all. Duplication is rampant. We see that across many different sources. In a lot of cases, the sources that we have to bring in, their core competency is not around data governance and data standardization and remediation and things of that nature, putting additional pressure on payers to have those processes set up within their internal systems so that they don't get in trouble for those first 3 items. Timeliness, Laura touched on some of the concerns around the act and timeliness of reporting and timeliness of updates for data. Well, timeliness is not a strength of the majority of the sources that need to be acquired and need to be ingested into a system so that you can stay up to date with certain provider attributes and thus reduce the need for outreach or physician abrasion. A lot of files are updated and thus acquired as soon as possible, but the majority are on a monthly basis. There are a few out there, obviously, that are updated daily and that are updated on a weekly basis. Those are helpful in your strategy. But data sourcing in general, there's a lot of issues that come with that. How to interpret the different sources each as their own, but find the commonality so that you can streamline your workflows, create your ETL processes, and optimize those types of interactions with the data sources so that you can increase the timeliness, reduce the duplication and the incomplete records, thus ensuring your compliance with the upcoming legislation and existing. And inactive and latent, I touched on it briefly with respect to timeliness, but inactive in one sense could mean something completely different in another sense from a data sourcing perspective. And to understand those discrepancies across sources is critical, and the different metadata attributes that are provided by those sources is critical to staying compliant with this legislation. The provider data challenges, some of these things that I've discussed here are not new, but they are also not going away, and in some cases, they are not getting any better. Go to the next slide, please. We take a look at a little bit of a case study. So CMS did a review not too long ago, but the overall provider data accuracy and had some interesting conclusions. You know, as you can see very clearly on the slide, CMS found that 52% of the provider data locations within these given directories had at least one inaccuracy. And the types of inaccuracies that were observed were the provider was not at the location listed, the phone number may have been incorrect, the provider was not accepting new patients, or the location wasn't, or the affiliation, i.e. the location for the provider wasn't correct. And as such, CMS did take issues with these. They issued notices of noncompliance. They sent warning letters in some cases, and in 12 cases, those warning letters were sent with request for a business plan to remediate those issues. Now, I call this out, and you can see clearly when this actually took place, but as I mentioned on the previous slides, and we'll continue to do on some of the upcoming slides, vigilance in this area does not stop. Vigilance in the inbound sources that you acquire, vigilance in your strategy to ensure these types of challenges do not continue is something that is an ongoing effort that needs to be taken quite seriously by the payers to avoid these types of issues, because as Laura indicated, these are direct impacts to consumers. Not only consumers, that causes challenges for consumers and for members, but it will also cause challenges with CMS and then the subsequent fines that may, or actions that may be taken upon the organization that has inaccuracies like this. Let's go to the next slide. Part of the reason why this is a still relevant conversation from the previous slide that we showed is that the provider data and the changes that we observe are not slowing down. We've looked back at our data historically, and we're sharing a couple of insights that we have found. We all know the provider universe, as the slide indicates, is always changing. Roughly 2.4% of provider demographics change every month. That's quite significant when you have a provider universe of nearly 3 million providers, or in some cases, if you need to track RNs, those folks with just a license, you're in around 10.5 million providers. Doctors will change affiliations. This goes back to the locations that they change. And how are you, as an organization, monitoring that change, validating that change, and taking action upon those changes within your data set and your downstream workflows so that it's actionable and correct? And then the 5% of doctors change the statuses all year. This is actually an interesting challenge. There's many different sources of data that provide us with insights into the status of a provider. Some will just provide insights given on the status of a certain license, not the overall provider. So you have to have a very robust sourcing strategy to hit multiple attributes for the providers so that you can accurately detect these status changes each year and make the appropriate downstream actions. Because if you are sending members to a doctor that is inactive at a given location, or holistically inactive, they have retired or something else, then that can be a challenge. And if you're not maintaining vigilance, as I said, across these different changes, we've noted through our own validation, as you see here in the next chart, in the next graph, that provider data, the demographic quality degrades quite rapidly over time. You start applying the above stats, when you start looking at them across month over month, they begin to rapidly add up. And when we discussed, and when Laura discussed the legislation looking for 2-day turnarounds in some cases of updated profile information, the challenge becomes quite clear. Lastly, a couple of different things that we also see. Human error is inevitable, right? And a lot of the sources that are required for payers to leverage to stay compliant, human data entry is still one of the biggest challenges, and a lack of standardization around that we see today. Multiple delivery methods of incoming transactions and updates. Talked about that a little bit. In order to be successful here, to maintain the appropriate vigilance across the demographic changes, across the degradation of data quality, to maintain that, to keep that up to date, you have to acquire many different sources with many different update frequencies, many different endpoints for you to connect to, many different schemas and coding that you have to adapt to in order to properly ingest the data and reflect the changes. And lastly, you see the data integration changes across different data sources and organizational silos. Organizations may have different silos of data that might not actually talk to each other, but may actually be beneficial if they do. So to have a central repository where you can have a one-stop shop of a complete view of a provider, integrating multiple different sources together to provide that information is critical to reduce those inaccuracies. Having the ability to have integrations, bring multiple data sources together, even via a third party, to bring those actionable insights together to formally collaborate a view of a provider is key to mitigating the risks in the previous slide and staying ahead of some of the challenges that we see here today. We call out some of the specifics, and we talk about it on a weekly basis when we look at our prescriber universe. So roughly 33,000 primary addresses changed. Now, it's important to note that that's the primary address. Keeping multiple providers practice at multiple locations, and the definition of primary is something that may vary from organization to organization, but the concept of having a primary address stays true. We see a lot of different addresses change from their primary status given during the course of the week. And at the same time, you take a step back and you look at all the different name changes that can lead to duplication within your data set, inaccuracies for the member when choosing a provider, potentially interacting with a provider. And even the phone and fax numbers. How do I, as a member, reach out to the provider if the phone number is inaccurate or the fax number is a challenge? So how do you keep those pieces of information up to date? The numbers on the right, more of the credentialing aspects, they play a role here in several different ways. 250,000 state license expiration and status changes in the given course of a week. That's a lot. What's key here is, although state license numbers themselves may not be as critical of a component to directory accuracy, they actually are. Because when you acquire information from the state licensing boards, you are picking up not only the license number, the expiration date, the type of license, you're picking up address information in some cases. You're picking up information that can help with specialty or determine truly what type of practitioner this individual is. State licensing, I can talk for a long time on this challenge. 360 boards across the United States. The commonalities between them are few and far between. They're not in the business of selling data, and they are good partners, and they understand the challenges, but the challenges that they provide, unfortunately, are many and take a lot of rigor to overcome, to consolidate, to make sure that the information that they provide is expressed back in a timely fashion. That qualifiers is another key indicator. The qualifier of a license provides the metadata of a license, essentially, can provide a lot of insight into the provider that's listed in a directory. Is that provider a resident? We see that sometimes on these licenses. Is there some sort of other activity that is specific to the state that that provider is in? This information tells us that as well, and also can tell us if the license is active or inactive, which should influence in some way, shape, or form the overall status for the provider and specifically the provider in a given state. DEA numbers, we all know what those are about. The DEA file is actually very timely. It comes out once a day. DEA is a fantastic source for address information because if you're a provider, one of the first things that you're going to do so that you can begin to write your scripts and see your patients is ensure compliance here. So that is a critical component. And when you think of DEA, don't just think of it as the number, but think about how that specific attribute and that specific source contribute to the overall view of the provider. That as we map back to the previous slides, there's a lot of change and can institute additional risk if not captured and acquired correctly and processed, correctly. Sanctions and deceased, I think that information is, and why it's important is relatively obvious. Sanction information is exceptionally critical, specifically for member information and is specific to the risks that Laura spoke about before. Sanction information is also highly sensitive. you must take appropriate action with that to ensure that if you are sanctioning a provider or flagging them as deceased, that you're doing that with the appropriate guidelines, the appropriate governance and on remediation processes already in place. And in many cases, the sanction boards, for the right reasons, that sanction information is quite skinny. And it is difficult to link to a provider without the right governance, the right processes, the right understanding of the data, and the right remediation processes already in place. So all of these different things, when we take a step back and we think about how it relates to a provider directory and the use cases and the risks that Laura talked about before, they all interact together. Just knowing the address is important, but it's not the only piece. Just having the correct name, same thing, that's very important, but it's not the right piece, not the complete piece. Knowing that the provider has the right state license number may or may not be important to the directory use case, but the additional attributes that you pick up as part of that sourcing, as part of that acquisition, absolutely are. Sanctions, as I said, goes without saying. But all of these components together are things that you have to have the appropriate strategy to both ingest, process, and send out to your downstream systems so that the information can be processed and can be accurate, keep you compliant, and keep the members happy, if you will. Go to the next slide. So when you think about it, there's many different aspects of data quality, but I like to focus through my career, I focused on these 4 specific areas, and they map very nicely to the legislation that's in place, and they map to specifically how payers need to look at their overall strategy for dealing with quality. Is the data accurate? That's pretty simple, pretty straightforward. But as we had said before, the sources, many of the sources that are required to acquire do not provide us with accurate information. There's pieces in there that certainly are, but which pieces are those? Is that data timely, and does it reflect real life as the slide indicates? That maps back to the sanction information, making sure that those types of negative news, if you will, are kept up to date and are reflected appropriately in a directory or not removed from a directory. Consistency is very important. If I have a directory and I consistently change the format of my specialties, the format of my addresses and names and so on and so forth, and show a lot of churn, that creates a lot of confusion. Now, as we had said before, there is a lot of churn, but it takes these principles here to make sure that you mine that churn correctly and apply that churn correctly so that you can ultimately have standardization of attributes. Go back to the state licensing boards because they provide us a lot of information that is very relevant to a directory use case. All of the majority of those sources and those boards operate independently, having their own layouts, their own schemas, their own coding methodologies. All of those must be mapped and applied back to a single consistent source of truth to avoid conflict and challenges for the payers and ultimately for the members and for compliance. Goes to that single source of truth. Completeness. Completeness is a common theme throughout. You take a look at the legislation, it may focus on some areas, but to have a complete profile of a provider for customers or for members is critical so that you as a payer understand the complete profile of a provider so that you can take the appropriate action. Does the data that you acquire, does the data that is being brought forward, does that support the business and compliance needs that you have? If you have a source that provides really good name and address, that's important, but they're missing certain pieces. And it takes that holistic approach of multiple sources to ensure that you get the completeness that you need to stay compliant and have your members and have happy members. Governance, again, another common theme throughout. You have to anticipate things going wrong with these sources. You have to anticipate things changing as we've shown in this slide. How do you handle them? Stewardship and auditing is a very important piece. To have the right processes in place so that you can react to feedback in a timely and appropriate manner that might come to you through a variety of different channels ahead of some of your sources, so that you can take action on that. For example, if you receive feedback that Dr. Laura is no longer at this location, and you check and your sources for Dr. Laura are coming in about 2 weeks, you need to be able to adjust to that. And you need to be able to make that change based off of that piece of information. Standard ongoing maintenance and processes is certainly a given. Given some of the things that we've talked about and some of the challenges, you have to have multiple layers of quality assurance in multiple spots. Simply looking at it through the raw source lens is a piece, but you need to look at it through the end project lens, ultimately take into account how your members look at the data as well. And that goes part and parcel to the stewardship and auditing and some of the standardization of attributes. So governance, the correct governance strategies across all the inbound sources and the files and such and the files and the directories that you put out, goes without saying, is critical. And it's of the utmost criticality that those governance processes aren't in just one spot, but to have multiple layers, and that you understand how those multiple layers interact with each other so that you hit on these different principles of data quality overall.
Let me unmute.
There you
go. So I want to get into, we've talked about now, and John did a great job covering, the breadth of data, the depth of data. We want to cover some recommendations and some thoughts on a strategy on how to prepare for this legislation. So really, the point of this whole webinar and us speaking to y'all today is starting the conversation. As we're waiting for the regulations, it's really important to have an understanding of what does this mean for your organization, and what do you have in place today, and what do you need to implement between now and January 1st to be able to meet the legislation. Specifically, again, I'll go back to the attributes that are covered under this regulations. We're talking about the provider's name, their location, their specialty, their phone number, and their digital contact information. As we've gone through this, I think one of the things I want to highlight is address and phone numbers are a challenge. There's no authoritative source for a provider's address, in the market. It takes a referential approach of bringing in multiple sources to really be able to understand how do I have an accurate profile for the provider. This legislation is also agnostic of product line. So it doesn't mention that this is just for commercial, just for Medicare, just for Medicaid. This is any provider that is in a member-facing directory needs to verify their information every 90 days. So you want to make sure that you have access to comprehensive and complete data for all licensed providers in the United States that would be in a member-facing directory. You want to make sure that you have a continuous update. Going back to John's comments on data governance and the challenge of keeping all of these data sets up to date, it's a problem that has existed for years, and it is a problem that again, the battery slide, right? It's not a problem that will just go away. A key part here too, as you all know, if you're responsible for pulling in data together, it's not just the sources of data you have, it's also your ability to pull all of that data together and reconcile it for one provider. This legislation will only add in additional streams of data that you will have to pull in and reconcile into one provider. You want to make sure that you have sophisticated algorithms that can handle all of that, that can make sure you have, not only the accurate profile, but the timeliness needed to meet the legislation. And really, again, the strategy here, like I said, is starting the conversation. We're a little ahead of the regulations, but it's important now to talk about where you're at today in terms of the ability to outreach to providers, get their verification, and consume that information back. And why it's important to talk about that now, I'll go into an outreach solution. If you want to, or if you don't have an existing solution today that outreaches to providers, we're talking about and this is industry wide. It takes a couple months to get something like this rolled out. In our experience, it's about 12 to 18 weeks. These are just some examples of the stages that would go through a deployment. You really need to understand where your data is today, what the baseline is, how accurate is the data today. Do you have providers in your member-facing directory that are deceased or sanctioned? And then once you go through that discovery process and you prepare a file for outreach, then you actually have to outreach to the providers to get them to confirm or verify what their information is accurate. All of that outreach takes time. So the actual outreach can take weeks to attempt to reach out to providers. We want to make sure, you have a solution that optimizes that outreach. Outreach is you don't want to outreach to a deceased provider, for example, going back to John's slide. You don't want to put that operational burden on your team. You want to make sure that you stratify that in a way that makes sense and it's cost effective for your organization. And then you have to plan a maintenance. You have to plan maintenance, right? So you have to figure out, how do I create a process that is repeatable every 90 days, because the legislation is asking for this to happen every 90 days. So again, the key here is now is the time to start planning for January 1st. If you don't have a solution in place today, now is the time to consider, where is your data at, where are your processes at today, and how do we prepare for January 1st, 2022 to meet this legislation? So in summary here, I'll take the summary. The legislation is effective January 1st. The provider verification is required every 90 days. The providers must be removed if they do not verify their information. Again, that's critical here to understand that a provider must be removed. We'll go back to those risks and common concerns. What does that mean for your organization if you have to remove a provider that hasn't verified their information? That's a new wrinkle in legislation. We've never seen a requirement that a provider actually be removed from the directory if they don't verify their information. So it's important to think about how you would go about doing that. Obviously, again, the regulations will drive some of the detail there, but it's important to think, what does that mean for your organization, not just your member-facing directory, but enterprise-wide, all of your data streams. And lastly, the time to act is now. Again, we're coming up on mid-year here, so it means that you have about 6 months to prepare for this. What steps do you as an organization need to take to be able to meet these regulations that we've covered? And start the conversation ahead of that regulation. You can still have a conversation around, where are we at today in terms of what the bill states? And when the regulation detail comes out, you can have some more conversation around the specifics of how you would roll out verifications to providers. So before we get into the last poll question, I have some time now scheduled. I think, how much time do we have left? We have about 20 minutes left in our time today. We wanted to get into some Q&A. I think we have had some questions along the way. John, if you could kind of go in there and see what we have, or now's the time. If you have any questions, anything you didn't think we covered, feel free to submit a question within that Q&A section, and we'll go to the Q&A now.
Mm-hmm. Yes, let's actually do the poll question first, and then we'll hop into the Q&A. I've been doing my best to monitor the Q&A and respond to some things along the way. We'll continue to do that.
Great. So the poll question here, obviously, we've talked about the industry. LexisNexis Risk Solution is an expert in provider data. So if you would like to have someone reach out to you, to have a conversation around what this means for your organization, we're happy to do that. So if you would like someone to contact you, feel free to answer the poll as yes. And if you would not, that you can ask no.
One of the big themes that we've seen as we fill out this poll, one of the big themes that we've seen in the chat is that is there going to be incentive for providers to update their information? I hope so. It's been a challenge for a long time. I mean, as I'm sure we're all familiar with, there is actually language in the NPES directory that says you must update this as you change things. The challenge is that there's not much enforcement there, if any. We have observed, and we continue to observe all of the update, relatively flat update from the MPI file as it pertains to new and updated profiles. Doesn't mean that it won't change, and it doesn't mean that even a small percentage of updates is a positive thing, but it's been relatively consistent. So that the key thing is that if that changes, have the right processes in place and thresholds so that when it changes, you know it and you can consume it. I know from past experiences that sometimes data sources will get a big update, and that could then expressing that back out to customers can cause problems. And that's something that you have to be aware of. It goes back into the data governance thing. So I'm hopeful that some of this legislation entices providers to keep their information more up to date. I know that Laura touched on it, and a lot of these sourcing strategies, we do like outreach is an important component of any sourcing strategy. However, it's always important to be cognizant of physician abrasion. So how best can you operationalize your outreach so that it's effective for both payer and the provider at the same time? Hopefully that when some of this legislation starts to get forward, providers will start to realize that. And that should be a good thing. I know it is the position of LexisNexis that where we can and where appropriate, we do often reference to providers, could you update your MPI information? Now that is, to be transparent, that is very few and far between, but when those opportunities do present themselves, we do make that suggestion. That was one of the big things. The other question that I saw was around enforcement. At this point, as Laura kind of indicated, we're watching. We're watching. We will and continue to watch to see if CMS issues any sort of statement on that. It's our position to maintain vigilance across that dimension, and at the same time, it's also important to make sure that your strategies are in place so that if any sort of changes or enforcement start to happen, you're prepared. We have some good insight into the legislation, as Laura indicated, and things that they're looking for. But as we all know, some things are always subject to change. So the strategy to be prepared is the best strategy. Okay. Apologize. We are just reading through some of the chat and looking at what we could potentially get a good answer that won't take up all the time. The one question is very, very similar to some of the data quality challenges. How do you manage providers to make complete attestation less than accurately or with a lack of diligence? We see this. So we do see this today. So this is part and parcel to your governance strategies and your multi-channel strategies for sourcing. With the exception of a very few things, you can't simply take all of a source as a source of truth. Algorithms have to be calibrated appropriately. Understanding of your data sources have to be taken into strong consideration. Attestation, while on the surface might sound like the holy grail, if you will, of high quality provider information, that's not always the case, as the question says. For example, it's an example we all know. The MPI is good for the MPI. for the MPI number. It has addresses, it has a couple of other things, and they're not always wrong. But you should be suspect of an address that you've only observed in the MPI file with the last update date of 2016, no presence of claims, so on and so forth. Same thing with an attestation. If I am let's say I'm a large group practice and I'm doing an attestation for my entire group and I am updating relatively quickly. If I don't update that address, or if I update that address and the attestation is the only spot where I see it, but I've just acquired the DEA file the other day, or so on and so forth, or I've performed outreach that tells me other indicators, that's the best way to mitigate some of those challenges. It's around constant governance, constant diligence, a multi-channel sourcing strategy, and understanding the nuances of those sources, and that can be difficult. As we've discussed here today, I would love one standard source of healthcare data. LexisNexis provides that, but the inbound sources that we ingest do not. That's some of the challenges that we take on.
Yeah, and I'll add to that a little bit too. I think, what we've seen in the past with provider outreach is that not every provider attests, right? So to John's point around how important it is to have that layer of data behind the scenes to either support a non-attested provider in a member-facing directory, or to verify, again, that what is attested is true, I think is really important. So you have to be confident in the data that you have when you're doing that outreach and getting that attestation to make sure that you agree with what the provider says. So that referential backing is really important to really complete the confidence that you have that what that provider is saying is accurate, truly is.
Mm-hmm. Okay. So there's a lot of good questions in the chat, and again, in the spirit of time, I'm looking for common themes so we could try to address multiple questions at once. So what I'd like to do actually is hopefully we can capture these questions and get some appropriate responses, because I think as I look through these are great questions. I really appreciate it, and it's outstanding. I want to make sure that we give them the right answers. So I think we're good. I think what I'd like to do is have the opportunity to answer some of these questions offline, if you will. We will get a report of these questions and we will get them. These are fantastic, and I really appreciate everybody's participation. These are good questions. I want to spend some time with them so that we can get you the right answers. But it looks like, again, a lot is around the quality, the maintenance, the attestation, and the updates of the providers and responsibility of the providers to keep their information up to date. There is that. Providers have some responsibility to keep some things up to date, but the challenge that we see is that the requirement to keep the license file up to date is different than that of the MPI, different than that of the DEA, different than that of another organization that they may be a part of. But the answer is bringing those together with different outreach and governance strategies to ensure the most accurate and timely pieces of information for a provider. And as Laura and I have both as Laura and I have both said throughout the presentation, making sure that you have the appropriate strategies that should you need to update information in a more timely fashion than what the reoccurring sources provide to you, that you can do that and you have those governance and processes already in place to prepare for what is coming.
Yeah, and I'll add to that, John. We've never seen, to my knowledge, in the past decade, I haven't seen legislation that actually required removal of a provider from a member-facing directory for non-compliance, for non-verification. So that in itself, without additional motivation or repercussions for the provider, that in itself is motivation to verify as well. Providers want to be able to treat as many patients as possible, right? And contract with as many payers as possible and strategically contract with payers. So if they know that the non-compliance would potentially remove them from a directory, that would have some consequences on their ability to treat patients and process claims and things like that. So I do think that has a level of puts a level of responsibility on the provider to attest to their information, or the office manager, the practice, to attest or to verify that their information is true.
Very good point. Very good point. There is an impact to the provider to not have their information up to date correctly on the directory that would impact their day-to-day. So that is incentive for sure. That's good. So I think, as I said before, we have access to the questions and we will respond. They're excellent questions, and we thank you all very much for the participation. The questions warrant time to respond to. So I appreciate that very much. I think that brings us to the conclusion of our webinar this afternoon. I want to thank Laura for all of her help in putting this together, and the rest of the team. And we hope everybody found this insightful, and it was a real pleasure to Laura. I think if you could move to your last slide, I think that would be good. Yes, there we go. I want to thank everybody for taking the time out of a busy day as we head into a holiday to spend some time with us. And thank you all very much for the time, and I hope you have a great rest of your day.
Thank you.